President announcing this week that he is halting funding for the World Health Organization, or at least considering it. It's always unclear whether when he says that thing, it happens. But it seems like a pretty transparent attempt to shift blame into scapegoat. But it is also true, this shouldn't be lost, in the early stages of the outbreak, the WHO did issue some guidance that now looks pretty bad, and that was overly deferential to what Chinese authorities were telling them, like tweeting out in mid-January, preliminary investigations conducted by the Chinese authorities have found no clear evidence of human-to-human transmission of the novel coronavirus, which obviously later turned out was far from true. That said, it is also the case, as the New York Times points out, that there is little evidence that the WHO is responsible for the disasters that have unfolded in Europe and then the United States. The virus, of course, doesn't care one way or the other about borders. Defunding the WHO, the preeminent global health institution fighting pandemics, would make it harder for dozens of developing countries to fight this pandemic, and that will not be better for the United States, obviously. Joining me now to talk more about this is Madeleine Albright, former Secretary of State under President Bill Clinton. She has a recent op-ed in the New York Times titled "The Best Response to Disaster is Resilience," and is the author of the brand new memoir, Hell and Other Destinations. Madam Secretary, let's start, I guess, on the criticisms of the WHO, which do seem somewhat legitimate, that in the early stages of this, whether out of a desire to not sever ties with Chinese authorities to get more information, or out of just excessive deference to them, that they were not forthcoming enough about what was going on with the virus. Do you think that's a fair critique?
Well, I think it's important to know where they get their information. I think one of the issues about the WHO is it depends on information from a variety of countries. It doesn't have an intelligence service of its own. I don't think things were malign. I think that there are issues that need to be looked into. But the more important point is that the United States, can't affect changes in the WHO if we're not at the table. I know, having been at the UN, that one has to be in the discussions. And for us to sort of just say we're not going to pay, we're not going to be a part of it, is counterproductive, because then we have no leverage. And so we do know the WHO cannot do everything. They do actually work with partners like the ones you talked to the doctor just a while ago, in terms of working with other organizations to get information. And then I have to say, having looked at the charts that you have, that you were showing, we need to know what's going on in other countries. And the bottom line is that we haven't even talked about what's going to happen in the developing world. So the WHO needs to have some reforms. We need it, and we need to be at the table.
Yeah, that last, the thing you mentioned I wanted to discuss with you, we had Samantha Power on, I believe, last week, who mentioned this, and there's been some writing about this. I mean, New York Times had an editorial about it as well. Countries that have, a total of 4 ventilators in them, places where, the amount of healthcare capacity is a tenth, orders of magnitude less than what the developed world has. The virus is going to arrive there sooner or later, and it seems to me that it's in U.S. self-interest, if nothing else, as well as humanitarian interest, for you to have a functioning WHO and a functioning U.S. effort abroad to help them fight the virus.
Absolutely. And I think if you think about what happens in a lot of countries, we're told to wash our hands constantly. In some of the developing countries, they don't have water, or water is very precious. They do all live together. It's a little hard to have social distancing. And as you said, and I've said, the virus knows no borders. And if one wants to look at it only as a zero-sum game, who's going to buy all the things that we produce? So for humanitarian reasons, we need to care about what happens in those countries, and for domestic security reasons. And so it's really, really short-sighted to cut off our access or to have some influence on the WHO. So it's one of those things. I do teach, by the way, and I keep telling my students they have to think about the unintended consequences of decisions. And I don't get that sense that the administration is thinking about the unintended consequences.
One of the sort of subtexts, sometimes explicit, of the attack on WHO and then China is that there is a growing voice on the right who clearly want some more confrontational posture towards China. They want to blame the virus entirely on China. They want to use it as a means of sort of fomenting a kind of U.S.-China Cold War. Like people call it disentanglement. And stipulated that the Xi government has been extremely repressive and brutal towards Uyghurs and bad in lots of ways. I mean, what do you make of this very perilous moment between the relationship of the U.S. and China amidst this virus?
Well, first of all, let me just say China will have a lot to answer for. There's no question. And all the issues that have been raised, you've raised and others have raised. But we need to look forward. And let me just say, I have not been in any task force meeting or discussion where we have not talked about China as the rising power. There's no question about it. And when we leave a vacuum, then they step in. So the art of diplomacy is being able to cooperate with countries when there are things you need to cooperate on and compete and stop them and tell it like it is when you have to do that. And what's happened is I think that we have been very confused about how we talk to the Chinese. I mean, President Trump says Xi is one of his best friends, and then all of a sudden he starts attacking. And so I do not want us to see a Cold War with the Chinese. I think we need to figure out where we can cooperate, for instance, on climate change and on trying to sort out now what to do. But I think there are areas we compete where we don't like what they do, and especially their human rights and Uyghurs and what they're doing in the South and East China Sea. And as a sophisticated country, the United States, we ought to be able to carry out that kind of diplomacy.
Do you think this moment, I mean, I worry a bit about this being a kind of altering the trajectory towards confrontation between the two nations in a way that could get quite ugly. I mean, just in terms of the rhetoric we've seen, we saw some rhetoric from official state ministers and propagandists of the Chinese Communist Party who were saying the U.S. Crafted the virus. You see American politicians really, really going hard at China. Do you see this as a kind of inflection point altering what the nature of that relationship is?
Well, I think it's possible. And then the other thing is there could be an accident of some kind. I know, especially in terms of ships in the South and East China Sea, hitting some fishing boat or various things like that, or lack of communication between the militaries. I think that what we need to do is to avoid any kind of a major confrontation with the Chinese. I do think that we need to object in things that they are doing wrong. I think we can see that their Belt and Road initiative is something where they are trying to seduce countries to be on their side. I keep saying the Chinese must be getting fatter and fatter because the belt is getting larger. They are all over the place. They are a competitor. And we have to watch that. There's no question. But we have to tell it like it is, find out what really did happen, but now try to figure out how to do something about the supply chain, for instance. What I find so confusing is a couple of days ago, we didn't have enough of anything. And all of a sudden, we have plenty of testing and masks and all that. And I think things are totally confusing at the moment. I have listened to the president's press conferences every night. He changes his mind. As Madeleine, just a plain old citizen, I don't quite know what's just happened. So I do think that the relationship with the Chinese, it is probably the most important one we have, and we need to practice and use our national security tools.
All right. Madeleine Albright, thank you so much for making time tonight.
Good to be with you. Thank you.